Welcome back to another episode of This Month in Health. I'm Liz Ortiz. This month, October, is Breast Cancer Awareness Month. It aims to promote screening and reduce the risk of breast cancer, as well as offer support to people diagnosed with the disease. According to the American Cancer Society, breast cancer is the most common cancer in women in the United States, except for skin cancers, and it accounts for about 30% or 1 in 3 of all new female cancers each year. So joining me now to talk more about breast cancer awareness is Dr. Rani Bansal, Assistant Professor of Medicine at Duke University School of Medicine. Dr. Bansal, thanks so much for your time today. Perfect. So I want to start off with just the basics of breast cancer. Walk me through what it is and sort of how it develops in the first place.
Yeah, so breast cancer is cancer of the breast within the breast tissue. And most commonly, there are two types of breast cancer: ductal, which is in the duct of the breast, or lobular, which is pretty much where the milk is made. And then when we think about breast cancer, we think about if the breast cancer is using estrogen to grow or not using estrogen to grow, or if it's also using something called HER2. And that's actually how we kind of describe the breast cancer and think about treatment.
And off the top, I mentioned breast cancer being the most common in the U.S. among women, except for skin cancers. Can you talk about the prevalence of it, how common it really is, and why?
Yeah. So we do know that breast cancer will affect about 1 in 8 women. And we do see that as women age, that is an increased risk factor for breast cancer. Other things that we notice as well can be obesity, alcohol use, tobacco use. And so these are different things that we're noticing can increase risk for breast cancer. We're also seeing breast cancer now in younger women, and we actually don't know yet why this trend is occurring. We think this could be differences in how women are having children, age of having children, younger age of puberty, things like that.
And you mentioned alcohol, smoking. Those seem to be, when it comes to cancer, even in general, those seem to be some of the main risk factors or things we could stop doing even to reduce our risk. Is that true?
Yes, we've seen that in many different cancers. I think especially with lung cancer, we've seen, the smoking risk there, and we actually have seen an improvement as our patients are smoking less, improvements in cancer risk as well. And so the recommendation is to quit smoking if patients are able to, and also limit alcohol intake.
And how about genetic factors and how that contributes to breast cancer risk?
So we do know that there are different genetic mutations that can increase a patient's risk for breast cancer. Some of these can be seen in different family trees, and then there's also breast cancer that we just see in families, and we don't know why. We don't have a genetic mutation yet that we find, but we can see that some patients just have many family members that have been affected with breast cancer.
And do you find that to be common among women to have
Well, it's
those genetic
actually
factors?
Yeah, so actually only about 10% of breast cancer is genetic, but about 15% is familial. So I think, about overall, that's about 20% of breast cancer that we're seeing.
And I want to go back to the age, and you mentioned sometimes we're seeing it in younger women even.
Yeah.
Previously, it seemed like something maybe it happened later in life, but we're seeing it so much younger now. Talk more about age and how that plays into breast cancer risk.
Yeah. So typically when we, study patients over time with breast cancer, we did see that as patients age, the risk of breast cancer is higher. Unfortunately, now in recent years, we've seen just an uptake of early onset cancers in general. So not only breast cancer, but also GI cancers such as colon cancer in younger and younger patients. We think that a lot of this may be due to, like we already talked about, maybe lifestyle changes that have occurred over the years, such as obesity rates, alcohol use rates, but we're not exactly sure why this is happening. I think a lot of this also comes into play when we think about screening and also early detection of breast cancer. I think it's very important that our younger patients are aware of the signs and symptoms of breast cancer and seek evaluation because breast cancer is no longer just a disease of older patients.
And let's talk about those signs and symptoms, maybe the earliest warning signs that may say to a woman, hey, you should go check this out.
Yeah. So what I always like to talk to my patients about is, you know your body best. So if you feel that something is different, such as a lump or a bump that wasn't there before, if you're noticing nipple changes or skin changes across the breast, that is really when I recommend you see a medical professional to be evaluated. And then they can help do a breast exam and then decide if breast imaging is needed.
And is it always a lump for sure that you feel that and that gives you that sign? Are there other symptoms, even maybe fatigue or other things that could all kind of play a role as well?
Yeah, that's a great question. So there is not always a lump. I will say that many early breast cancers present without any physical changes in the breast, and it's something that we notice on imaging. Some of my patients will feel sometimes breast pain, breast tenderness, and even fatigue as an early symptom. And so really it's just talking with your doctor or your provider to kind of get a sense of if you need to have breast imaging.
And I know we talk a lot about women having breast cancer, but this does affect men as well. Can you talk about that and the prevalence of breast cancer in men?
Yeah, so breast cancer can affect men. It's much less prevalent in men than in women, but especially for men that may have a genetic mutation that puts them at risk for breast cancer, such as a BRCA mutation. We do see breast cancer occur in men. Currently, there are no screening recommendations for men for breast cancer, given how rare it is. But for many men, they do present with a breast mass or feeling something on their chest. And then we treat breast cancer pretty similarly in men as in women.
And I know this month focuses a lot on really pushing the importance of early detection. Can you really talk more about that importance? Why is it that we need to really, really focus on early detection when it comes to breast cancer?
Yes, definitely. So we do know that we are able to treat breast cancers and hopefully get rid of the breast cancer if they're diagnosed early. And so we know that, if patients are able to get their screening mammography at the correct time intervals, then our hope is that we're able to catch a breast cancer if it occurs earlier rather than at a later stage of disease.
Absolutely. And let's go into screening guidelines. What are the current breast cancer screening recommendations and why are those so important?
Yeah, so most of the current guidelines recommend definitely starting mammography screening at age 45. There are some guidelines as well suggesting that some patients can also start at the age of 40. And most of these guidelines suggest yearly or at least every other year screening. I think there are also recommendations for patients that may be at a higher risk for breast cancer. And there's many different ways we can look at this. If a patient has a genetic mutation that puts them at risk for breast cancer, or if they are younger age but have many family members who have had breast cancer. So it's very important that patients talk about this with their providers.
And I know there are different tools or screening tools when it comes to breast cancer screening. Maybe the most common or the one we hear about the most that is mammograms. Can you talk
Mhm.
about how effective they are in detecting breast cancer and the other tools as well?
Yeah, of course. So, there are also different types of mammograms. So, we have our screening mammograms, which is typically what's used for screening patients to look to see if there are any abnormalities. And these tests are pretty sensitive. If something is found on a screening mammogram that looks abnormal or the breast radiologist is concerned about, we typically then perform what's called a diagnostic mammogram, which pretty much looks at the breast more in depth and has potentially different images of the breast. Many patients also will then go on to get an ultrasound as well, and that can really look at the area that we may be worried about. For some patients, they may then need to go on to get a biopsy. That doesn't mean that's definitely a cancer there, but that's kind of the sequence of events when we look at something that we're worried about in the breast.
And just to tell my own personal story, that exact sequence of events that you just mentioned was something that I dealt with earlier this year.
Yeah.
Doing a self exam, noticing a lump, going to get a mammogram, doing the ultrasound, then a
Yeah.
biopsy. Everything turned out to be okay, which is great.
Good.
But that really, as you talked about, just the importance of those self exams as well to really know your body and know when things are changing.
No, definitely. I think I always tell my patients, you know your body best. So if you feel like something is off, you let your provider know.
And in my case, I felt the lump and I said, I got to go to the doctor, check this out. Is that the very next step? You find something unusual. What should we do next?
That's what I recommend for my
Yeah.
patients. I think, if you know your body best and you see your provider, whether that be your primary care, your OB-GYN provider, and we get referrals all the time from our, just for our patients to get a mammogram. And then as things, if they need to see an oncologist, they're usually set up through our radiology team to see us. So, there is definitely a process in place if patients need care.
And if breast cancer, a woman is diagnosed with breast cancer, can you talk about sort of the different stages of breast cancer and then why that staging matters in that journey there for this woman?
Yeah, definitely. So there are four stages of breast cancer. And typically, when we think about the stage, it really just means the size of the tumor, if there are any lymph nodes involved, and then if the tumor has spread anywhere distant in the body, or pretty much to an area outside of the breast or the lymph nodes. And the reason why the stage is important is it gives us information about prognosis, but also how we think about treatment. And so typically, stage one breast cancers tend to be smaller tumors that have not gone to the lymph nodes usually. And many times, those breast cancers can be treated with surgery, radiation, and those patients may not need chemotherapy. However, there are certain types of breast cancer where that may be different for us. That's why the stage and the type of breast cancer is very important for us to figure out.
And just to kind of go back into the treatment plans, so let's say a woman finds out she's in a later stage of breast cancer, maybe 3 or 4. What could that treatment plan look like?
Yeah, so, we think of stage three breast cancer as a breast cancer that's, more advanced or has gone to many lymph nodes, potentially a very large tumor. Many of those patients will need chemotherapy as part of their treatment plan with the hope to be able to also have a surgery and radiation. Stage four breast cancer is actually considered metastatic breast cancer. And unfortunately, we won't be able to cure that breast cancer, but our treatments have gotten much better and that we're able to have our patients living much longer, even with metastatic breast cancer.
And that was going to be my next question. I know over the years there have been so many advancements in medicine
Mhm.
when it comes to breast cancer screening and diagnosis and treatment. How has that changed the outcomes for women over the last maybe decade or so?
Yeah, no, we are really pushing the envelope in terms of allowing our patients to live longer. Our goal is to cure more and more breast cancers. And I do think our treatments are allowing that. I think, my hope is one day that we will really be able to cure every stage of breast cancer. And I do think our drugs are getting more and more targeted. We're also personalizing breast cancer treatment more. We're looking more at mutations in the cancer and trying to target that. So I do think the field is evolving.
And when we talk about the breast cancer treatments, I know it varies obviously on your stage, but talk about some of the common side effects women may experience if they're going through chemotherapy or radiation or any other sort of treatment related to breast cancer.
Yes, definitely. So there are a lot of new treatments we have besides just chemotherapy and radiation, such as immunotherapy, which I like to think of uses our body's immune system to target the cancer. We have anti-estrogen pills. We have targeted therapies, which actually target the cancer cells. So we really have increased our toolkit that we have to treat breast cancer. Unfortunately, a lot of side effects with some of these medicines can be for hair loss for some of my patients during treatment, which can be very hard. But we're working on ways to help prevent that. Neuropathy, which can be numbness or tingling in the hands and the feet, and then nausea or diarrhea. But we've gotten much better at treating many of the side effects related to treatment.
Yeah, and I was going to ask that next. What are the options for patients to manage those symptoms as they navigate this?
Yeah, so a lot of it is actually making sure you're communicating with your oncology team. We have a great team where it's the provider, but also your oncology nurse, as well as a patient navigator. So there's many different members that patients can reach out to make sure that they're expressing their concerns and also what side effects they're having. So of course, talking about those side effects as they occur early on is really the best way for us to help prevent them. For hair loss, for example, we're using things such as cold capping, where we're having patients put helmets of cold air on their head to help prevent with hair loss during chemo. So we're just coming up with new ways to help prevent some of these side effects.
Again, it's great to see all of the advancements, of course, and I know women feel positive when they hear about those advancements in research and treatment and those sort of things. So, Dr. Bansal, we're going to take a quick break right there. When we come back, we'll talk more about the prevention strategies, how we can support patients or maybe our own family members or friends who could be dealing with breast cancer, and then more on ongoing research. I know research is constantly happening, so we'll talk more about that when we come back.
That's great.
Welcome back to This Month in Health. We continue talking with Dr. Bansal about Breast Cancer Awareness Month, which is this month, the month of October. So, Dr. Bansal, I want to jump back in now, talking about preventative measures women can take to reduce their risk of breast cancer. What are some things we can do to reduce the risk?
Yeah, that's a great question. So we know that obesity does increase risk for breast cancer. So I always educate my patients on trying to maintain a healthy diet, a healthy lifestyle in terms of exercise. I usually tell my patients our goal in exercise at least 3 times a week, 30 minutes. We want to get some cardio in as well as strength training, as well as eating a balanced diet. We typically focus on the Mediterranean diet, which is a diet more focused on fruits, vegetables, lean meats, less processed foods, as well as limiting alcohol intake and tobacco use.
Yeah, all important things we can sort of start to implement. I know it's hard with the eating as well. And maybe your patients have talked about this. It's difficult to kind of keep on that healthy diet, especially when we're so busy with life
Yeah.
and just, not having time to stop and cook, maybe just grab something fast. I'm sure you've heard that from your patients.
Oh, definitely. And I think that's where a nutritionist has been
Yeah.
really helpful for many of my patients. So sometimes I'll have my team refer my patients to a nutritionist who can really work with what does a diet look like that works for our patients in their busy lifestyle.
Yeah, an important resource for sure. How about genetic testing and counseling when it comes to preventing breast cancer? I know some women and even celebrities have talked about this in the past where they may have a family history of breast cancer. So they just say, let me do this genetic testing and see sort of where I am in this. Talk about testing, that is, and sort of how that works.
Yes, definitely. So I think, a lot of times currently right now in terms of genetic testing, a lot of it is based off risk factors the patient may have. So definitely family history,
Yeah.
especially if a patient has a family member that has a known genetic mutation that increases the risk for breast cancer, then we do recommend that other family members get tested just so they have that information. And it also may inform how we think about screening for these patients. And so we may recommend what we call high risk screening, which may be more frequent imaging instead of just once a year. So some patients we will use an MRI of the breast, which is a different type of imaging if they have a higher risk for breast cancer because of a genetic mutation.
And can we also talk about dense breast tissue? I know, at least in my case, because of that, I had to do the ultrasound, but actually both mammogram and ultrasound. Um, Talk about dense breast tissue, if I can get that word out, and why
Yeah.
that's different for some women.
Yes, definitely. So it is something that especially our breast radiologists can notice when they're looking at imaging for women, and it can obscure abnormalities in the breast. So it can make when they're looking at imaging, trying to figure out if there is something abnormal more difficult. Many times what we can then look at is what is the patient's age? Are there other risk factors that make them at increased risk for breast cancer? And if they have dense breasts, consider if we need to use other imaging modalities. So just as you mentioned, we have ultrasound. We also many times will use MRI for these patients because it's different ways that we can look at the breast tissue.
Right, right. And for patients who, they have breast cancer, what can we as family members, as friends, do to support someone who is undergoing treatment?
I think there are many different ways to help support, patients who have breast cancer. I think the first is just being there and listening as, patients go on their journey in terms of breast cancer care and treatment. I will say that every patient's journey with breast cancer is different. And so different patients will need different treatments. Some patients may need more aggressive surgery. Some patients may need more aggressive radiation or chemotherapy or other treatments. And so it's really going to be different in terms of what each patient needs. And so I just, when family members ask me that, I say just listen and see, where you can help out for our patients.
And even in the community as well, especially October in particular, we see so many walks or events to support patients and survivors. I'm sure you see a lot of those locally as well.
Oh, yes, definitely. And many of those are so helpful because they'll raise funds for patients who can't afford to cover their treatment or can't afford to cover support that goes with their treatment, such as that cold capping, like I mentioned. So those can be really great events to help support our patients.
How critical is that support for a patient going through a breast cancer journey, just to have friends, family, or whomever by their side to support them in this?
I think it really changes how they experience treatment. I mean, I do definitely think that, and we do have some data showing this, that patients that have a poor support system may do worse on treatment. And so I do think a support system is very important in general for cancer patients going through treatment.
Yeah, absolutely. I want to talk about research. I know, we touched on this already. Research is constantly, it's ongoing, it's evolving. There's are constantly developments. Where are we in breast cancer research with treatment, even prevention? Where are we now and where do we hope to go from here?
Yes, that's a great question. So we are, I mean, fortunately, the world of breast cancer research is evolving, and we have new drugs getting approved. It seems like pretty much almost every month and or every few months, which is great for our patients. My hope is we have continue to have more and more options, and we continue to move that needle closer and closer for a true cure for all of our breast cancer patients. There is a lot looking into new drugs for breast cancer, but also different ways of thinking about the treatment of breast cancer. We also have clinical trials looking at vaccines for breast cancer. So I do think the future is very bright.
And speaking of clinical trials, what are they exactly? How can a person get involved if they are interested?
Yes, great question. So, clinical trials are pretty much looking at potentially a new drug or a new investigational device or something different than that's currently the standard of care and trying to see if it's better than what we're doing right now. There are many different phases of a clinical trial. So, some of my patients ask me about this. There's a phase one, two, and three. And that's pretty much how typically most drugs can move through to get approval by the FDA. Phase one means that we've tested this drug in the lab, but now we're testing it in humans to see what the drug looks like in terms of safety. Phase two means we're looking to see if there's a signal for treatment or benefit. And then phase three typically means we're going to compare it to what we do right now. And that's really the way to make sure that we are moving drugs and other therapies through in a safe way for our patients.
So it clearly means that it is important for people to get involved in these clinical trials if they qualify based on the recommendations for it and that sort of thing.
Yes, I always tell my patients, don't be afraid to ask, is there a clinical trial that I may be eligible for? It's always voluntary, but I do think that information is key because it's a way we can get our patients access to new drugs.
Is there anything else besides clinical trials that the public can do to get involved in research and awareness efforts, not just this month for October, but really year round?
Yeah, I mean, I think spreading awareness is a big thing. I think for many of our patients, just thinking about getting their mammograms on time, talking with their family about history of cancer, talking with their provider if they are younger and have risk factors, and seeing if they need to go on earlier screening. I think those are always very important. Supporting your community, and so like you had already mentioned, if there are walks or fundraisers, helping to support cancer patients, just getting involved can really make a difference.
Any resources in particular, maybe online or in person, that you would suggest or offer to someone who wants to learn more about breast cancer, ways they can maybe help a loved one or support a loved one, any resource that would be beneficial?
Yes, I mean, the American Cancer Society has great resources for many of our patients. Here at Duke, we also have our breast cancer program online that has access to all of the clinical trials that we offer for patients, and so do many of the universities and medical centers here in North Carolina. And so I think those are great places for patients to start.
Perfect. Well, Dr. Bansal, before I let you go, any final message about breast cancer awareness, education that you really want viewers to take away from our conversation?
Yeah, I really think, the future of breast cancer care is evolving and changing. And I do think that we will have many more options for patients. And my hope is, a cure for all patients.
Perfect. All right, Dr. Bansal, thank you so much for your time and sharing more information about Breast Cancer Awareness Month. We appreciate it.
Thank you for having me.
Of course. And that'll do it for this episode of This Month in Health. I'm Liz Ortiz.